Good morning. Let's see. I'd like to call this meeting to order. And first, I'd like to have a motion to...
Just roll call. Just roll call.
Just roll call. Okay. First, I'd like to ask the Secretary, Madam Secretary, to please call the roll.
Director Harrington.
Present.
Director Westercross. Present. And Chair Curry.
Present.
You have a quorum.
Thank you. Do we have any directors joining remotely?
We do not.
Okay. Can I have a motion to allow director?
Oh, we don't need that. That's just in case. I'm sorry. That motion.
Okay, great.
Just in case we have someone remotely connected, but we don't right now. So that's just if needed.
Okay, thank you. All right. The next regular meeting of the Managed Care Committee will be held on Friday, July 19th. Madam Secretary, do we have any public testimony?
We did not receive any registrations for testimony nor any written testimony.
Thank you. We'd like to move on to the next agenda item, which will be the report on health plan services. Aaron Galena, Chief Administrative Officer of Health Plan Services, will review the report and the metrics. Alex Lumington, Interim Chief Marketing Communications Officer, will review the slides regarding marketing updates. No action or motion is required. We're only presenting information. Mr. Gleaner.
Great. Thank you, Chair, and good morning, directors.
Good morning.
To cover our initial agenda, we'll walk through our health plan metrics and then cover a number of different strategic initiatives and topics today, including redeterminations, an update on our County Care Access program, which is serving the health benefits for immigrant adult and seniors population that is newly coming into county care. We'll provide an update on the Health Choice Illinois RFP process, as well as cover a variety of quality and equity topics. And finally, we'll hand it off to Alex to cover the Choice campaign and marketing updates for the health plan. We'll start with our usual metrics this morning, beginning with membership. So we are at 442,000 members, just shy of 443,000 members as of April. This is an increase from the prior month, which we'll talk about here in a couple of slides. In terms of the ACHN members, we are holding relatively proportionally at just shy of 36,000 members that are impaneled to our Cook County Health Clinics. The next slide shows our market share data. This is data that's published by the state, and the latest update is through December. We are anxiously awaiting the updates through January through April, as we expect that will show an increase in our county care market share as we've brought on the HBIA and HBIS membership. The rest of the market has stayed relatively steady. We have seen Blue Cross increase a couple tenths of a % over the past year, with some of that increase appearing to come from some of the other health plans in the market. But generally, the market's been pretty stable throughout the past year. The next slide shows our trends in membership versus the overall managed care Medicaid market in Cook County. And so you can see that our membership is tracking very closely with that overall Medicaid managed care membership. This is also through December. And again, we expect as we look at January through April, this you may see some differences there given our transition with the HBIA, HBIS members. The next slide shows our membership compared to our budget. You can see the month-over-month increases here, starting in January and going through April. There's really two different impacts that are happening right now within the health plan. The first is redetermination, which we've been discussing for the past year. We have this large wave of members that are going through the redetermination process since the first time, from the first time before the pandemic. So that's causing a decrease in membership. That is what we were expecting when we did the budget this year. You can see the blue bars on the slide is what our budget projection was. And so you can see the month-over-month decreases that we're expecting from that impact. However, beginning in January, the state transitioned the healthy benefit for immigrant adult and seniors population into managed care. What that meant for us in Cook County is that almost all of that population was auto-assigned into county care. And that's really driving the increase you see there from January through April. That transition was done over the course of four months. So April was the last of that enrollment, that transition into managed care. So we expect that we'll start to see month-over-month declines from the redetermination impact starting again here in May. But we do have that initial increase for the first quarter of this year, and we expect that generally, compared to the budget, we're going to have a very strong membership result throughout the rest of this year. The next slide shows our operating metrics. So this outlines call center performance as well as claims and encounters acceptance rates, which is a measure of accuracy of data we're submitting back to the state, which is a state requirement. You can see that generally we're operating well within SLAs here. There was an increase in call volume, which really occurred from December to January. We saw an increase from about 40,000 calls a month up into the 50,000 calls a month range. So we made some adjustments in our staffing and modeling there, and a lot of that, of course, relates to the transition of the new population into our plan, as well as a number of members go through the open enrollment cycle towards the beginning of the year. So we just see an increase in total of call volume. So you can see in terms of percent calls answered in 30 seconds and average speed to answer, that as we readjusted some of that staffing, that the numbers improved there, but never really fell outside of what we would expect in terms of our SLA measures. The next slide shows our inpatient acute trends, so admissions per 1,000 members. The red bars here are the prior period. The blue bars are the current period. We continue to generally see a decrease in utilization year over year. We do expect that trend will somewhat reverse as redetermination continues, and the individuals that likely will stay with the plan will have somewhat higher acuity than those that may leave the plan due to the redetermination process. You'll notice here in December, January, and February, you'll see the white shading, which is projections. We have seen a little bit more of a data lag as we get into the current months for a couple different reasons. One is there's just been a little bit slower impact of providers joining us because of the Change Healthcare cyber attack, as well as there's generally just a lag in data completion with claims data over the course of several months. But we project utilization going forward using our utilization management data, as well as some actuarial modeling. So you can see in the light blue shading, which is a little hard to see on the slide, but we're projecting that the blue bars to eventually start outpacing the prior period, likely beginning at the early part of this year. The next slide shows our claims payment trends. This has been steadily going back down since the end of year budget rollover, which is good news, and what we would like to see, would have liked to see this happen a little more quickly than it has, but I think we're in good shape now. I actually just got an updated report a few minutes before this, and we are right at that 30-day mark now, which is the overall target that we're trying to hit. The next slide shows the claims aging just broken down by aging categories. So most of that uptick you see was in the 30 to 60-day time frame, and so we've driven that pretty much back down to being very minimal at this point, and expect we'll continue that trend throughout the rest of the year until the next end of year budget rollover. Okay, transitioning out of our metric slides, the first area we wanted to highlight was redetermination. You can see in the blue line here on the slide, this is overall retention rate from the redetermination cycle. That's generally held between 84 and 85%, which is great. That's better than what we initially had projected, which was closer to 80%. And we've continued to see, compared to the rest of the market, that we're outperforming most of the other MCOs in terms of overall retention. We did see a slight decrease in that retention rate in February. We are doing a little bit of deeper dive into that data. It looks like that was just overall a really high volume month for individuals going through that process. So we're now doing a little extra work to target some of those members who may have not made it through the process. We still have some window of time that we can continue to engage with them, and they can be have their coverage reinstated. So there's a little bit of catch-up work that's happening there. The other impact that we're seeing is that the state is now putting individuals that are in that healthy benefit for immigrant adult population through the redetermination process, and they're doing that generally in one larger wave rather than a more phased approach that we saw with the rest of the population. So a lot of that is starting to hit as well. So we'll see more of that impact as we look at this data in April and May. But that's something that we're also very, very focused on right now. And we're seeing a lot of response and a huge increase at our redetermination events specific to that population that's looking for additional support through the process. The next slide shows a summary of those redetermination events held. I'm really excited about these numbers. We have built out our community outreach team over the past really 18 months. So we're continuing to increase the staffing of that team, but they've been working tirelessly through this redetermination process, doing generally about an event a day. And you can see that we're well over 150, close to 180 events held from May through February, and May is really when we began that process with the team. And so you can see the increase in numbers just month over month. We're getting a really good response from members that are showing up to those events and being supported through the process. There's pre-work done where we outreach to members that are in that geography. If they respond and let us know they're coming, we can pre-print forms that are pre-filled out for them, that are their redeterminations forms, so we can literally walk them through on site through the forms that are aligned with the state process and help them through that right there on site. And then we also leverage that process to engage with them around other things like their health risk screens, if they need healthy food support. So there's a number of things we're able to do through those community outreach events. And then looking forward, as we move past this large wave of redetermination, we'll really be looking at leveraging these events for a lot of closure of quality of care gaps and a number of other things that we can do to help support members that go beyond just the redetermination focus that we have right now. The next slide shows some of the focus of those groups. So in addition to just the events, we've also been building out a lot of community-based partnerships throughout this process. So this shows some of that, for example, with the faith-based community, especially on the south side of Chicago. We've had really good engagement. We've had our community outreach team that has spoken at those churches, for example, on Sundays about the redetermination process to help get information out. We have just a large number of events. We have a number of mechanisms that we've built to get messages out through those communities. And so, again, this is a growing area for us and one that I think we're seeing really great results from, and we're excited to see continue to evolve going forward. Next slide. Transitions us to provide some detail around the Healthy Benefit for Immigrant Adult, what we call our County Care Access program. So as a reminder, this is a fully state-funded program, so it's a little different than the standard Medicaid program. This was launched by the states probably 18 to 24 months ago to cover individuals that would otherwise qualify for Medicaid with the exception of their residency or citizenship status. So these individuals have been covered if their age is 42 and over, and otherwise meet the other Medicaid requirements in terms of income. The state has frozen enrollment into this program. There's no new individuals coming onto the program. And that's also something that we're very focused on, the redetermination process for these individuals, because if they don't successfully complete that process, there's no mechanism for them to re-enroll later on if they lose coverage. So it's doubly important that they have the ability to retain their coverage through this process. This shows how many individuals have come onto the plan from January through April. So in total, you'll see in the bottom right corner there that just shy of 35,000 individuals have been onboarded through this process, and generally between 8,000 to 10,000 individuals each month have been coming on to the County Care program. We are providing the same benefit structure, no copays, no cost sharing, the same rewards and incentives to this population as any other population within our County Care program receive. We were also excited that through the state readiness audits that we received a 100% score. That's an evaluation the state does to ensure that we're prepared to handle the new population coming into the health plan. And this just summarizes, excuse me, some of the benefits, again, that we're offering, and that we align these benefits with our overall County Care population. We've spent a lot of time and focus on the information, as well as ensuring that we're being thoughtful in how we're staffing, especially around bilingual staff, and ensuring that we're doing a lot of translation of materials, reaching out to these individuals in preferred languages, and helping support them through the process of managed care. For most of these individuals, they're relatively new to coverage through Medicaid generally, and then very new to the Medicaid managed care process. So over the past 18 to 24 months, they've really had two significant transitions in their health care. So we're trying to ensure that we can provide as much education and engagement with them early on coming into the plan as possible. So one other update we wanted to provide, as you'll recall, we had been speaking about the expected Health Choice Illinois RFP process that we were expecting to occur this spring. So this is the process where the state reprocures all of the Medicaid managed care contracts with the state of Illinois. The state has announced that they're going to be delaying that process by 1 year. Likely just because of some of the leadership transition that's happened within the Illinois Healthcare and Family Services Department. So previously, we were expecting the RFP process to start this spring with contracts that would begin for the calendar year 2026 period. Everything is now expected to be delayed 1 year, so the RFP will likely be occurring at some point next spring. All of the MCOs are receiving a 1 year extension on their current contracts. So our contract that goes through calendar year 2025 will now go through calendar year 2026. And then the new contracts with Medicaid managed care organizations that win the bid with the state would begin effective January 1st of 2027. We have been doing a lot of preparation work leading up to the spring, expecting that RFP process to commence. So we've actually already completed a couple drafts of what our RFP response would be. So this gives us some additional time for preparation, both in terms of just what we have in the draft, kind of the overall information and data that we're using in that draft to support and highlight a lot of the benefits that and accomplishments that County Care has had over the past 10 to 12 years that we have been operating in state. But this also gives us a chance to take a step back and evaluate what are some of the other key initiatives we want to put in place over this next 12 months heading into that RFP response, and ensuring that a lot of the initiatives that we have are also aligned with the state's goals so that we can best represent ourselves as we head through that process going forward. All right, and with that, I am going to hand it over to Sherry on our team, who is with us virtually, to cover some of the quality and equity slides.
Hey, good morning, everyone. I'm Sherry Offervine. Executive Director of Clinical Services. And I am going to present updates for the, hang on one second, because I'm getting, okay. So I'm going to provide some updates for the Clinical Services Department and strategies that we have been working on to improve quality and outcomes for our members. So this is just an overview of the structure that we have put in place that shows that we are engaging all parts of our health plan in driving things forward. We're focused on a variety of different categories to move things forward, what we need from a people perspective, how we can continuously improve our processes, how we partner with different organizations, and then the systems that we need to drive the work that we're doing. Next slide, please. This is just an overview of some of the accomplishments that we've had, specifically focusing a lot of our efforts on improving behavioral health outcomes for our members because they're our most vulnerable populations. We have onboarded a complex care management manager really to focus on that. We're looking at how we can create partnerships and work with community-based services. We're working with telehealth to support this vulnerable population, and we're really auditing and monitoring all of our work processes and outcomes for constant continuous improvement. And then we're looking at ways that we can understand the movement of our members between different agencies and levels of care by looking at optimization of ADT information. On the next slide, there is information about how operations and member services has supported these initiatives. So we're really looking at how we can increase our incentives that help our members to be incentivized to be following up with different strategies like follow-up care, looking at texting and other ways that we can reach members, and then looking at an analysis of our traffic. So how are our members reaching out to us both through the call center and through our website to access information. On the next slide, you can see that our network team, working from a value-based care lens, is looking at ways that we can secure additional
Sherry, are you there? If you can hear me, it appears that you've frozen. Maybe we should disconnect her so she has the
And I can chime in while Sherry's trying to reconnect, and apologies, I know she's at a conference today and trying to join remotely, but as Sherry mentioned, a lot of our focus on the quality side is really around two core areas: behavioral health and then maternal child health. So behavioral health, specific to the network, we are very focused on trying to move forward on particularly follow-up measures, so follow-up after hospitalization and follow-up after emergency department use. We've done a lot of work in terms of trying to understand access points and the access challenges that are particularly problematic for Medicaid individuals trying to get behavioral health access. So we have really began pushing forward on a telehealth strategy to try to supplement that access, as well as have moved into a couple value-based care contracts with a couple entities that are specialized around behavioral health and represent a collection of behavioral health community-based providers and community mental health centers to help support the population through the process. And then we're also looking at trying to build more bridges with the hospitals in our network, particularly moving towards getting staff on site at some of those hospitals so that we can support individuals from the discharge process and help connect them directly into appointments for follow-up care as part of that process, rather than trying to outreach and engage after they've left the hospital.
I think she's having connection problems, and so I'm going to keep trying to get her back in.
Okay, that's fine.
If you want to keep going.
I'm happy to keep going. In terms of the finance team, so we continue supporting the incentive structure and process of those value-based agreements, as well as working with providers around coding documentation and risk adjustment strategies related to behavioral health within our plan. And really, this is just representing that each area of our health plan is engaged and focused around these broader quality strategies that we have.
I believe Sherry has connected. Sherry, are you there?
I am here. I'm sorry. I apologize. I lost my connection to Teams.
It's okay. So can you can see the screen, right? You good?
I can, yes. Yes.
Okay, excellent.
Okay, so I think Aaron may have, did you finish this slide?
I did.
Okay, so just to talk a little bit more about our behavioral health initiative, you know, because this is a key focus for us in managing this vulnerable population, we did create a strategic roadmap for all of 2024. We're looking at monthly and quarterly tactics and goals. We're really leveraging our professional staff, which is great for us. The health plan is fortunate to have great qualified professional staff to drive these initiatives. We're also looking at statewide resources to help us from a behavioral health network performance. We're very excited about the HFS Healthcare Transformation Collaborative awardees and how they're also supporting our behavioral health goals. And then certainly collaborating with our CME partners who have brought so much benefit to the health plan and helping us to navigate supporting our members. The next slide provides a little bit of information about our maternal child health strategy. So maternal child health is also key for us to support our vulnerable pregnant members who need to get seen as soon as possible for their prenatal care, certainly hopefully within that first trimester or at least, and then to get the postpartum care that they need after their delivery. And so leveraging those resources and making sure that they can get the follow-up care that's required. We also are looking at how social determinants of
Sherry, if you can hear me, it looks like you're muted.
Yeah, I'm happy to jump back in. So we're also continuing to work on social determinant of health investments related to this population. One of the initial ones is our food care program, which is going to be providing medically tailored meals for individuals that are pregnant. And
can you hear me? I'm sorry.
We can hear you.
On the next slide, there's information about communication to our members. So we're really working on those texting campaigns. This is a specific age group that benefits from that type of outreach. We have our great diaper bag pilot, which was really engaging. We're looking at community baby showers to really engage those community members. And then really working to optimize our specialty care providers with the maternal health care management team, and then also looking at a telehealth vendor that can support us with maternal child health care. We're looking at various tactics to engage our network with specialists, and then as I mentioned, the lactation consultants and doula programs, and then also looking at how our HEDIS measures are performing in this important category. Next slide, please. And then I want to talk about our equity efforts. Those are especially important to us within the health plan. And so one of those strategies is around smoking cessation. We're really looking at our strategies to promote education and timely screening around smoking cessation, because smoking impacts so many other aspects of care. Creating that education and that understanding of the importance of screening and engaging with our members at various opportunities and points of contact, putting together those tools to assist members in navigating screening, Members who have a smoking history, getting them connected with lung cancer screening so that early detection can assist in their outcomes. And then looking at a wide array of ways that we can connect with them. And then also doing outreach for members who have comorbid conditions such as asthma and COPD, and high-risk members like those who are pregnant. Next slide. And then community health and health promotion. So we're really looking at getting our members into that annual primary care visit, which is so incredibly important in creating both those relationships to manage and prevent disease, but also for early detection. And we know that that 20 to 44 age group is the one that kind of thinks that they're indestructible. And so we're working diligently to create communication and engagement strategies to help to engage that population that has the greatest opportunity so that they can get connected with primary care and continue to manage their health. On the next slide, I want to talk a little bit about our housing program. So we, as you know, participate in the flexible housing pool since 2021. We have been invested in that partnership. And the idea is really to provide permanent housing, which has such a significant impact on health outcomes. The program really is designed to provide housing and wraparound services. There was a target to engage 67 county care members for that 3-year residency period. And the intent is really to work both in collaboration for case managers to assist in housing security and care managers to assist in healthcare issues. Here's just a breakdown that shows the demographics of our flexible housing pool members. So 78% of the participants are Black or African American, 22% relative risk reduction in jail registrations, which is great. 19% relative risk reduction in ED visits, and then a 33% relative risk reduction in incurring inpatient days. And on the next slide, there is just a little bit more information about the variety of different housing programs who have supported our members. So in addition to the flexible housing pool, some Wellness West programs, the IDA program, and then the Boulevard, which is not permanent housing, it's sort of transitional housing that offers medical respite and then assists people who are in need of supportive housing so that they can move on to different permanent housing programs. Next slide. And this just shows the strategy around the RFP that we're working on to expand housing. The goal is really to build that end-to-end housing strategy, and the intent is really housing first. So we're starting at the very beginning with assisting people who are housed but who are at risk in prevention from eviction, but then also managing people who are unsheltered and then helping people who are sheltered stay that way, and then all the way across the gamut to how we can support affordable housing and then housing development that's specifically focused on creating supportive housing for the long term. And then the next slide shows kind of the structure around that. The idea is really to provide that tenancy support that prevents people from losing their housing. It assists with workforce development so that people are able to work and maintain finances that will allow them to support housing. We know that when people get into housing, they also face many different issues with deposits and not having furnishings and things like that. And then also supporting vulnerable members who have issues and need assistance with legal services, childcare, and then also understanding how to manage finances to sustain their housing. The next slide shows really how we're prioritizing this from a health equity lens. So we're prioritizing populations living in DIA zip codes. So these are disproportionately impacted areas. And then prioritizing that marginalized population, pregnant individuals, people who are involved with the justice system, LGBTQ+ youth, and then especially vulnerable youth who are transitioning out of the foster system. Next slide. And then this just shows the great progress we've seen in the average cost of claims for our members as they've been a part of the flexible housing pool and the incidental impact that housing has had. So we went from a high of $5,700 in average claim cost down to a little over $2,000 in average claims cost over the almost 500-day period. So it demonstrates that secure housing does have an impact on how people are able to navigate and manage their health. Next slide. And then this shows pharmacy consistency. So we know that often members who are unhoused are challenged with behavioral health or chronic health conditions, and they are often better stabilized and managed with good pharmacy utilization. And so we have seen a steady increase in consistency with medication fills for members who are housed in this program. And on the next slide, just this recognition was very exciting for County Care to be recognized for their support and contribution to the flexible housing pool. It is such an honor and a privilege to support this work and understand the key impact of the work that's being done. Next slide. And then just some quick health equity updates around the food care program. So we know and we'll see on the next slide that housing and nutrition both have an impact on health outcomes. So the objectives with the food care program really are to have a sustainable program on the opportunity to not just give one-time food to our members, but also to educate them on how to manage their diet, select healthy food, use their resources and benefits to access food. The intent is really, that we want to reduce the overall cost of care and improve health outcomes and reduce chronic diseases, but we also want to address food insecurity and provide access to healthy food, and then allow members to understand how to navigate the system to get those. Next slide. So we started small, where we just gave emergency food for 2 meals per day for 14 days in that very initial phase, and then advanced that in the second quarter to have a full program that included that counseling and engagement with a registered dietitian to talk about what does a healthy diet look like, how do you navigate that. And then in our third phase, we really focused on those medically tailored meals that are specifically for people who have health conditions that are directly impacted by diet. So diabetes, high blood pressure, high cholesterol, and then our vulnerable members with gestational diabetes. Next slide. And then this just shows those different categories of how we've measured this to make sure that it's successful. So we have those basic process measures. When someone outreaches, are they engaged? How many visits were completed? When they were getting meal deliveries, were the meal deliveries on time, and did they have the appropriate food? But we're also looking at those key outcome measures of increasing nutrition awareness, weight loss, reduction in those impacted diseases like diabetes and cholesterol, and then looking at how that impacts the cost and structure of the health plan with savings per member per month and other issues like that. Next slide. And then here's just a quick overview. So our goal was to have 10% enrollment. We came really, really close at 9.5% enrollment. It was about 43,000 members who were enrolled. We had over 20,000 initial telenutrition visits, and then ongoing visits that exceeded 88,000. And then we had a total of almost 110,000 visits. We were able to deliver over 47,000 emergency meals, and we have had over 1,000 members who are enrolled in our medically tailored meal program in March, which is the highest number of engaged members to date. And then on the next slide, this is just a member success story. I won't read you the whole thing, but basically, this was one of our members who engaged in the food care program. And based on her counseling and discussions with the dietitian, she set goals for herself, and she looked at how she wanted to navigate improving her nutrition, and that expanded to her family. She engaged her children in the things that she was doing. The whole family got more active and more conscious about the importance of food, which was a huge benefit to her and felt life-changing based on her experience. And then here's an overview of our justice involved programs. So, we're really looking at people all across the justice involved continuum. They're supported to apply for Medicaid as they are in the system, and then county care is working to support those members as they transition. We are outreaching to them to assure that we have the correct information, that we're able to screen them and engage them in the proper programs for them. We're looking at how we can really put together a whole package to address social determinants of healthcare management and other barriers this population has, and tracking how these improvements are going across time. And on the next slide, there's a little bit more detail about the various different needs that this population has been identified to have. Certainly, they have a higher level of behavioral health conditions and complex medical conditions. They're challenged by certain social determinants of health. And then especially vulnerable are members who are pregnant and also in the justice system. And so working to get them connected with an enhanced level of management in all the other programs that we're using to support our vulnerable members. And then on the next slide, there is just some demographics about our Justice Involved program as of January of 2024. 4 out of 5 of our Justice Involved members do live in those disproportionately impacted areas, which I'm sure is no surprise. A little over 64% are Black or African American, and almost 16% are white. And then overwhelmingly, this population is male, with a very small segment being female. And then on the next slide, we see what our key priorities are. So we're really working diligently to hire a social worker who is there at CIRMAC specifically to act as a liaison and help to navigate our county care members. We have implemented a transition plan that includes an SDOH screener. So it's a quick assessment that can be done with the member to walk through what their needs and challenges are. We're working at partnering with parole officers to continue to support those members in successfully remaining in the community. It helps us to better understand risks of recidivism and how we can support reducing that, and then brainstorming to look at other opportunities that we can use to support this population. Next slide, please. And then here's just some next steps that we're working on from a health equity perspective. So we're looking at NCQA health equity accreditation. This is a great potential accomplishment. So we're doing that readiness assessment right now and setting that timeline for the application process. County Care cares about climate change. So we're looking at how we can create that climate change plan and support strategies, especially for our members who are impacted by environmental racism based on where they live. And then we're continuing to work closely with the 1115 waiver programs that will help us to address health-related social needs, and partnering with community partners specifically as those waivers continue to be rolled out. This might be my last slide. That's it. Thank you so much. I apologize for the disruption.
Thank you.
Thank you. And just a comment before I hand it off to Alex. Sherry mentioned the 1115 waiver. We know a lot of the conversations between the state and CMS have been, it sounds like there's some more active engagement around that process. And we heard recently that there's some hope that that 1115 waiver may be approved at some point this summer. So we're really looking forward to that. A number of the programs that we just outlined related to those health-related social needs are included in that waiver. And so that 1115 waiver will likely give us a lot of mechanisms to accelerate that work, a lot more opportunities to fund some of that work. And I think we're really well positioned to take advantage of that given the foundation we've laid through a number of those programs. So just wanted to provide that context before I hand it off to Alex.
I have a few questions. And she went through the slides pretty quickly, but on the housing programs, there are 79 members currently enrolled. So that was way back. I think it was slide 46 or 47 to 65. I was just wondering or curious about how many of our members are in unstable housing or unhoused, or do we know?
Yeah, depending on the exact way we measure that is high as 20% of our total membership indicates some version of housing insecurity. Now, that doesn't necessarily mean that they're completely unhoused, but that they're not necessarily in a situation that they feel is a stable housing situation. So there is a really large need. A lot of the work that we've done here related to these 79 members is on the very far end of that spectrum, right? So it's permanent supportive housing, which involves complete wraparound services for those individuals. We're fully funding the housing that's being provided. And so the goal of the RFP process that we mentioned is to be able to serve that broader need and help members across that spectrum of their housing needs. So that can, you know, be the much lower cost, kind of lower intervention of eviction prevention and assistance with needs on that end, which will give us the ability to reach a lot more members, which to your point on how many of our members are we seeing with the housing need in our population, there's a very large component of our population. So we're trying to find a broader approach that can meet members across that spectrum.
So if it's 20%, would that be somewhere between 8,000 to 9,000?
That would be up, you know, as high as potentially 80 to 100,000 members.
Yeah, and yeah, on the justice involved demographics, and the vast majority were Black or African American, but there was no Hispanic.
So the category on that data, there's a not provided category, and that's a little bit of a misnomer based on the way we get information and from the state on some of our population. What we find when we bump that data up against some different sources is that typically the vast majority of that not provided category is likely the Latinx population.
Thank you.
All right, good morning. I'm Alex Normington, Interim Chief Communications and Marketing Officer. I'm here today to share with you the results from our recent Choice campaign. We're really excited with the results of this campaign. Our concept was Bring on the Benefits. We saw that resounded very well with our audiences. So as a reminder, we typically do a large annual campaign between October and January, February. We know that that's when a critical mass of our members have their choice period when they would select their plan. So we want to be sure to be in markets during that time to ensure that we are top of mind for folks. Our goals for this campaign were to increase awareness about county care and engagement with the health plan, and we're measuring that through impressions for our marketing efforts, also calls and clicks. Calls to the call center was the big call to action for this campaign. Given all the noise and confusion in the market relative to READY, thanks to your support, we were able to increase our spend for this campaign by about 60%, so just over $2 million. And we saw great results. It really allowed us to increase the breadth and depth of our campaign. We did radio and print for the first time in several years, and we were able to extend our campaign for a longer duration. You'll see here that since the plan started, we had over 991 million impressions and 305 total campaign clicks. And we generated over 31,000 calls to our call center through these campaigns, which we can track through the digital assets in particular. So since the campaign started, we saw our satisfaction with the plan increase to a record high of 82%. Again, a lot of members are very excited to continue with the plan, with 90% ranked saying that they're very likely to stay. And then we increased our Net Promoter Score during the campaign period from a positive 59 to a positive 76. I think everyone should be really proud of that score. That means that a large proportion of our members think positively about the health plan. And in healthcare, we look at a plus 30 or a plus 40 as solid. So to have a plus 76 is really exciting. And also, really importantly, we saw growth in choice enrollment that correlated with our campaign.
Alex, let me ask a question. It's probably very small. I didn't ask the other day. So our theme here, bring on the benefits, which is, I know it's in English, but literally when it's transferred over, están aquí sus beneficios, which says, here are your benefits. Was a conscious decision made in how that messaging to in English versus Spanish?
Absolutely. So we took several concepts to focus groups, both in English and in Spanish. And we said, here are the concepts that we're looking at. You know, does this resonate with you? How does the verbiage sound? So we actually fine-tuned that a little bit from our initial translation to make sure that it tracked.
Very good. Thank you.
And the next slide, please. So in February, we updated our campaign creative, and we really focused on quality. This is in alignment with the upcoming CAP survey. We wanted to make sure that when folks thought of county care, they thought of quality and compassionate care, and we hope that it will be reflected in our CAP survey. So for the month of February, we saw over 2 million impressions for those assets alone, including 11,000 clicks. You can see some of the samples of the creative up, focusing on some of the awards and star ratings that we received. We're really grateful for Dr. Collins and Cindy San Miguel for lending their talents to some TikTok videos, talking about how county care takes feedback from CAP surveys and makes changes and how responsive we are to our members. I will also say that we have created a landing page for CAP to help explain what it is. Sometimes people will get a survey in the mail and they won't think it's important, but we want to make members aware that their feedback is critical to our plan and that we will make changes and amendments based on the feedback that we receive. But knowing that not everyone receives the CAP survey, we still wanted to capture feedback from folks who might not be invited to participate. So we created a field where people can enter in their own information, and then we're collecting that as well to give another venue for participation. Next slide, please. And so on this graph, you'll see choice membership and against our campaign performance. So you'll see in October is when we started our campaign with our small investment. We really were saturating the market in November and December, and then we continued on into January and February. And what you'll notice in that time is that we were averaging 1,200 or so members coming in through choice a month, and then when we were peak in market, we saw 4,700 new members choose county care as their health plan in that time. So we were really pleased to see that correlation between the time that we were in market and the new choice members that we gained. I'll also point out that this didn't necessarily account for any plan members who re-upped with county care because they saw their positive sentiments reinforced in our marketing. So we're looking forward to continuing our marketing efforts, and Erin and I have been talking, about how we can continue to capitalize on this success, what our options are for being in market longer to stay top of mind for folks outside of this choice period in the fall and winter. So we're really excited about the results here, and we'll continue to grow them. And I would be remiss if I didn't give a huge kudos to Luis Alvaray, our Director of Marketing, who worked really hard on this campaign, our partners at Res Publica Group, and a la carte media, our MBE-WBE media buyer, for their support, because this was a substantially bigger campaign than we've done in the past, but we saw a tremendous ROI from it. So it's really exciting that we've been able to evolve and become a more precise in our targeting as we've done more and more of these campaigns. I'm happy to answer any questions. Thank you.
And before we wrap up, I just wanted to also thank Alex and her team. They've done an incredible job this year with the campaign, and I'm really excited about the results we've seen, particularly the choice enrollment. There's really two main ways that we get members into the plan. One is auto assignment through the state. When a member doesn't make a choice of plan, the state will auto assign them to a plan, and that's based on a formula they have around which plans have the highest quality scores. So we've always been well positioned on that front. But this is the first year that we've really been able to drive growth in that choice population of which members are choosing us as a health plan, where we've always had to compete with the branding of Blue Cross and some of the other large national firms. So it's been really exciting. During this campaign, we've seen that we are getting a higher market share than our current market share. So right now we're at about a third of the market. We've exceeded that in a couple of those months during this campaign of members that are choosing us, which is a great testament to the work that Alex and her team have done, and is really exciting for the impact for the plan going forward.
Yeah, I believe that the visibility this time around, the selection of where you place these visuals is important, and I can testify in my driving throughout neighborhoods, communities, on expressways. It's been a sustained effort of seeing these messages, and that sticks. So kudos again to your team and with the professionals that you've engaged to make decisions about where to place this messaging. And it's been a good sustained effort.
Thank you.
Paying off.
We put a lot of thought into those priority zip codes, and we also have a new media buyer supporting who's brought a lot to the table. So it's been a very exciting campaign.
Thank you.
Thank you.
Okay, I'd like to move on to the next agenda item 4, the January 19, 2024 meeting minutes. These were approved by the board at the February meeting, but are being presented for the committee's review and discussion if necessary. Or any corrections need to be made to the minutes? Okay. Hearing none, then, I'd like to entertain a motion to accept the minutes of the Managed Care Committee meeting of January 19, 2024.
So moved.
Have a motion.
Second.
It's been moved and seconded to the vote. All in favor?
Aye.
Aye. All opposed? The ayes have it. The motion carries.
And Mr. Chair, just for the record, Director Sorrell joined us remotely. We don't need a motion for it because she's just informational purposes as the director, right?
Okay. Welcome, Director Sorrell. Okay. This concludes our business for today. The agenda is exhausted and all items have been addressed. So I would like to declare the meeting adjourned.
Thank you.